I'm very pleased to be here as we break ground on our new Center for Advanced Medicine and Surgery at White Plains Hospital. We're here today because of the dedication of leaders and community members over the decades who are committed and focused on creating the best hospital in the region. In 1893, White Plains Hospital started as a 4-room house with no running water. A few years later, it had a primitive operating room with no anesthesia. And for the ensuing 126 years, the hospital continued to grow exponentially, evolving as medicine did and transforming alongside our community, always adapting to meet their growing needs. The White Plains Hospital of today is not your grandmother's community hospital. Far from it.
It was really only a few years ago that we broke ground on our lobby and our new cancer center. We are standing here in what will soon be the lobby of the new outpatient center, which will provide advanced outpatient medicine and surgery. It will be a significant building, over 250,000 square feet, 9 stories plus a lower level. In the lobby, there will be a pharmacy, a cafe, and comfortable seating areas. On the second level, there will be an advanced radiology center featuring the latest imaging technology, including everything from X-ray to ultrasound to MRI to PET scan capability.
The new building is going to be fantastic for radiology. We're going to be able to put in some of the highest end, most state-of-the-art equipment in the whole area and be able to provide care that is unparalleled to make the best diagnosis and help patient care as much as possible.
On the third floor will be a state-of-the-art ambulatory surgery center with 6 new operating rooms for patients who don't require an overnight stay. On the 4th floor will be our endoscopy center with 2 additional rooms for GI and other procedures.
One of the advantages of this new building is the fact that it's physically connected to both the cancer building as well as the hospital, so that if there's any patient need that arises in the ambulatory setting, we simply roll them down the hallway into the hospital where they can get that care. With the new capabilities in this building, that will open up space for us to then expand what we can offer our inpatient population.
On the 5th floor will be a comprehensive women's imaging center, and above that, on the 6th floor will be our maternal fetal medicine for high-risk women to receive advanced monitoring during pregnancy.
In my field right now, prenatal diagnosis and genetic diagnosis are really expanding, and I think in our hospital office building with the technology we'll be able to offer patients a lot more in terms of information about their pregnancy.
The top 3 floors will house our specialized physicians. On floor 7 will be the Heart and Vascular Center.
Our goal is to create a world-class cardiac electrophysiology program right here in White Plains so that we can offer the best possible care and the best possible treatment options for our patients here in Westchester.
On floor 8 will house our orthopedic surgeons and spine surgeons. Our 9th floor will house our surgical specialist offices.
The new building will have a new wound care center, which will also provide hyperbaric oxygen treatment, which is really an advanced therapy and will complete the armamentarium of our wound care center.
This is a visible commitment of our hospital's vision and mission to continue to transform now and for future generations.
This building is a milestone in a long journey of White Plains Hospital for the last 126 years.
What we're doing is we're providing care in a more appropriate setting and bringing more advanced, complex, specialized care to patients in our community.
We're going to be able to separate acute care from wellness care.
We are an anchor institution in this community. We anchor it, it anchors us.
Having a hospital of this caliber in your city is of incalculable value. And not just to the people who live here, but the people who work here and the people throughout the region.
Well, I've practiced for over 20 years in New York City, and now here at White Plains, I can tell you the level of care is on a par, if not better, than the care you can receive in the city hospitals.
I trained for a long time to be able to provide top-notch, high-quality care, and I wanted to be in a facility where there were other world-class physicians and a world-class facility, and I wanted to do it in Westchester. So for me, White Plains Hospital was the right option for that.
Most physicians are coming to White Plains because they see and they feel the growth. With affiliation of Montefiore, we have a lot more resources that we can utilize to provide this best possible care.
I was recruited to become the Director of Interventional Oncology because of my background in performing a lot of liver-directed therapy and liver intervention. I saw White Plains as a blank slate to be part of a multidisciplinary program. Here we had a chance to build something, and being part of that was an exciting opportunity for me.
We are now working in conjunction with our colleagues at Montefiore in neurosurgery for minimally invasive approaches to tumors of the skull base and pituitary tumors. We offer everything that any city hospital would offer in a environment that is more centered on the patient and the patient experience.
I find that the administration listens to the physicians, they invest in the physicians, and they are determined to make this place not just a tertiary medical center, but a great tertiary medical center. And the pieces are falling into place to make that happen.